To the Nurses Station, everyone. We're so happy to be here again with you. As you know, this is our bi-weekly show that we have, and you can find it at nursing.emory.edu and wherever it is that you listen to your podcasts. And also, please join our discussion on LinkedIn, the Nurses Station. We want to hear what your thoughts are, your comments. We really do read them. It's kind of like school evaluations. We ask students to do them, and they think that we don't read them, but we really do. So hopefully we can get some engagement from our viewers. So today we are going to talk about racism, and diversity in healthcare context, which is a very hot topic right now, especially with the racial unrest that is going on right now in our country. And so I think that this will be a good episode, so we can get the perspectives from our other co-hosts, our wonderful Alexis Dunn, Tim Cunningham, and Carolyn Clevenger. So how have y'all been since we were last together? What's going on?
Well, the semester is getting going, so I'm just trying to keep my head above water, honestly, Roxana. Just juggling a lot of different things, but I'm in good spirits.
That's awesome. Tim?
Roxana, I'm learning to make plans because so much of my job is about planning for our entire healthcare workforce of nurses. And with every single plan I make, I've learned to make for that another plan for that plan to change, because everything still continues to feel like it's just getting flipped around. And so learning to roll with that, but doing okay.
The uncertainty continues.
Absolutely.
And Carolyn?
Well, I think I've maybe got a new lease on professional life. I got a virtual assistant last week who's working with me, and I haven't had administrative support for a few weeks because of some staff transitions. And so she's getting onboarded, and it's just, I can feel some of my shoulders coming out from my ears because I was so worked up. And my calendar, she got to see it for the first time last week. And I did promise it was a dumpster fire in there, and I didn't lie. But there's hope for the future. So I'm pretty excited.
Congrats. Yeah. Do you think, will you ever get to meet your virtual assistants in person? Or are they are they out in Oregon somewhere?
Close. They're definitely in another time zone.
Oh, wow.
Mm-hmm.
Wait, is your virtual assistant a real person, or is it like a Siri, Alexis kind of person?
I was thinking the same thing. I'm like, virtual assistant.
That's learning you, artificial intelligence going on there?
No, she's a real person. She's a real person. And honestly, I have as much contact with her as I have with any of my other colleagues. We see each other on Zoom.
Nice.
And by text.
All right. So a lot has been going on. We are still in the midst of a global pandemic. How's everybody holding up with that? And, the numbers are still escalating. Schools have started, public schools and universities, and we are seeing some outbreaks going on. And what are your thoughts on that, Lexi?
Well, I think COVID is teaching us a lot, in the educational setting. We, as professors, think we knew a lot and as experts, but, there's one thing, and nature sometimes teaches us some things. And so I think for me, and just looking at with my children starting back in school, just taking the time, I hope that we as a country can figure out how to navigate this so we can kind of get back to our new norm. I just hope that we can all stay sane in the process. I think there's a lot of mental health components that we have to address. But overall, I think that all of this that's happening is just getting us to all slow down. It's like, you have to take care of this first, and then we'll be able to move forward. So I'm just looking forward to seeing how the country can kind of come back from it.
Yeah, we're feeling a lot of tension on the healthcare side right now. As what about flu season, which is right around the corner? As that comes on, and how is that going to add to our challenges addressing COVID? Thinking about folks that don't have access to care, thinking about our community members who might get sick with the flu and it might look like COVID, and how will that spiral, and what is that going to look like? And as we think about that, I want to echo your thoughts, Lexi. I had a phone call this morning with a colleague, a researcher here at Emory, and she was talking about how we just got to pause We got to hit the pause button. And as we're ramping up, flu is coming, can we still take a moment to say, all right, there's a whole lot of disruption. Can we listen to it? Can we see what we're learning from it? And can we change the way we're thinking about things? Even though we feel like we don't have time, I feel so rushed right now, but I think it's so important. We got to pause. And we don't know how long that pause is going to be, but we have to be willing to take it, I think. That's tough.
Right. That's another new word, twindemic, with corona and influenza. Another new word I didn't need to add to my dictionary.
Yeah.
Yeah.
But it's real.
Mm-hmm.
Yeah, but then on top of that, I've seen lots of headlines where racism is a epidemic as well, and it's a public health crisis that's going on in our country right now, and lots of racial unrest going on, and a lot of thinking and reflecting on our past and like how we are doing presently to try to reckon with that and make things better. So, I'm wondering, we hear a lot about racial racisms and structures in healthcare. And one of the things I wonder is, what is industry healthcare doing to kind of make that go away, to improve the care that our most vulnerable patients, sometimes immigrants and people of color, receive?
In reflection and response to the murders of Breonna Taylor, of George Floyd, at the time of this recording, the country is reeling with the wounding and paralyzing, I just read in the news this morning, of Jacob Blake, who was shot in the back 7 times in front of his children. I can say right now, there's a lot of talk, and that heartens me, but also concerns me, because I've worked in other places, other organizations where there have been, I call them acute on chronic flares of social injustice. The chronic being from the beginning of this country, built on the backs of enslaved people. The acute being the murders of innocent people, the racial injustice that we see when immigration comes in the conversation, when innocent Black men and women are shot by police. When that flares, a lot of people talk about it. And I don't always see the traction of long-term, prolonged work to work on it. One thing we're doing in my office, we've established monthly equity, diversity, and inclusion conversations with all of our nurse educators, because it's something that we've been hearing from our learners, like COVID sucks. It's hard to come to work with COVID, but, and I've heard this from multiple of my nurses that I work with, and they've said, as a person of color, it's also so incredibly challenging to come into work, to go back home, to be in this place of social injustice. So conversations happening, the structural changes, we got a lot of work to do. A lot of work to do. And I am hopeful that these conversations don't stop until we see those changes. But I wish I had a clear answer. I don't.
Well, I was going to say, and this conversation is pretty tough for me for a lot of obvious reasons. And a lot of times when you're talking about race and racism, you have to be in a safe space. And I know that this is something that's going to go out. So a lot of things I say with caution, but passionately. And to answer your question, Roxana, I don't think the healthcare system is doing really, I'm not going to say anything. There is a lot of talk, and there's always been a lot of talk. There have always been killings. This country, if you think about the term race in and of itself, particularly in America, it is a designation based on these physical features that are designated by the society. And the fact that the society was built with this inherent superiority of one group and inferiority of others inherently makes that term race biased just from the beginning. And if you think about the healthcare system, you have this superior group that has developed the system, has developed the knowledge, that has set the standards by which everybody else is compared. And then you have outcomes. And so when you look at people of color or immigrants or groups that are disproportionately affected with these bad outcomes, and you're like, well, why do these groups keep having all these bad outcomes? And then you kind of go back to, well, they need to eat better, or they need to, go to the doctor, or they need everything they need to do. But you are missing that you have to go back a step above that and look at the system that was put in place, that was not designed with them in mind, that the knowledge that's created was not created with them in mind, but you're using that as the standard to judge the outcome. And then your interventions are targeting the knowledge that you create from this flawed system. So until the healthcare system does a massive remake, I don't think that we're going to see any differences in the outcomes that you're seeing in the healthcare system. It's just not going to happen. And all the talk, you know, insanity is doing the same thing over and over again, expecting a different result. We keep talking and then nothing changes. So I'm hopeful that, you know, we can do better, but I'm not putting all my eggs in that basket right now.
Lexi, in one of our last episodes, you had made a comment about the nursing profession reflecting the populations that we serve. And that's, I've been sitting with that. That really resonated with me as I think about leadership structures. And if you look at leadership structures in most healthcare organizations, and the one that I'm working for, we have a lot of staff clinical nurses, and I think we do a pretty good job matching the populations we serve at the clinical nurse level, which is an important, critical level. At the same time, as you climb sort of that ladder with titles, with letters behind the name, it gets really white really quickly. And there is not that level of representation. And I feel like that, I mean, that has to change too. And
how do you do that? You know, the question, you know, the thing about it is very hard to come in as an outsider somewhat and infiltrate into that system, because you have to somewhat code switch. And for people that don't know what that means is, you know, me as a Black person, I have to learn the environment in which I'm functioning that is in many ways very different from my own culture that I grow in. So I have to speak the language, I have to look a certain kind of way, and I have to present a certain kind of way for people to believe what's coming out of my mouth. One of the things I've had challenges as a Black person as an advanced practice is people believing that I'm educated and that I have the same skill set as my white colleagues. I've had people, it's almost like I have to be validated by someone else, which in some cases is okay, but until we can get to a place where I can carry my own weight, it's not gonna really change. And so in order to increase more of us at a higher level, I think the people in power have to realize that there's a historical story in America that has to be addressed. You have to understand that what Black people and immigrants and what they're saying is real. It's hard to live in America. It is hard to be Black in America. It's very hard to be Black in the healthcare system as a provider. And until people can accept that as the truth and understand that and those biases lead to these poor outcomes, then Tim, you're not gonna see people like me wanting to ascend into those boardrooms, because you get tired of having to fight. You wanna fight because you want it better, but then at the same time, it is tiring. It's tiring to come in and say, no, we need to be more democratic in how we approach care. We need to consider people's pain. I've had nurses tell me stories recently, new mothers of Black boys. I'm doing these groups, I work at the Atlanta Birth Center. And we've started these groups where we talk to Black moms, kind of like a safe group. And one of the providers shared a story about she overheard some nurses at the nursing station invalidating a story of a Black mom who was literally in tears because she's so scared about bringing forth a Black son now in this time. And they're like, you know, it's not that serious. I mean, you know, it's like people just dismiss it. I'm sorry, I feel like I'm rambling. I don't want to dominate the conversation, but just to answer your question,
keep going.
It's very hard to you want to make change, but it's uncomfortable. It's uncomfortable. And also as a Black person, other Black people look at you as almost a sellout because you're in these white institutions. You know, I've also received that kind of those biases from my own, in a sense of where you're at Emory, and that means you're kind of playing the game. You kind of like, you know, you remember back in early America, you had the kind of Black people that were there for entertainment. So they kind of look at you as, oh, you know, you're just kind of playing the role in there. You're not one of us because you are in that system. They don't look at it as you're trying to change that system. So you have where you're not accepted on one regard and you're not accepted on the other one either. So.
And then how do you find grounding with that, right? If you're not grounded in one or the other.
I'm figuring it out. I'm still figuring it out. I don't know. I struggle, honestly. It can be lonely, but I know that I can't stop because I feel that I'm called to be where I am, and I can only trust the process.
Yeah.
Yeah.
That's all I have.
I think this is there's so many issues that I think about, the policy issues, and like so many of them are health policy because they affect people's health. And so I generally am really grateful when people bring healthcare professionals into the conversation, in this conversation about racism. I worry because we have a lot of work to do ourselves. We have a lot to do, from really basic things like, some of the things we hope to do around like quality of care, at least to be transparent with data that, do we at least offer the same treatments to every patient, and then let them decide whether or not that's for them? Do we engage in those conversations, just trying to be transparent about the numbers? It took so long this year to find out. We knew there were differences by race category in COVID infections and deaths. And it took so long to raise that to a national conversation, or to be able to see those numbers in real time, the same way we see the other statistics around COVID. So, to at least have that transparency. And Alexi, I think a lot about sponsors, right? So how do people get into positions of influence and authority? Someone sponsors you, right? Like, to get to those higher levels, so many times when I talk to leaders who are in leader development programs for myself, there were milestone moments when someone tapped me on the shoulder and said, I think you could do this. And I didn't see it. And when that sponsor looks like you, there are pros and cons to that. And there are pros and cons to someone who doesn't look like you, intentionally tapping people on the shoulder who are not represented very well in those leadership circles to say, you really need to be here, and I know you can do it. We have a lot of work to do.
Yeah. So, Tim, I feel like I always pick on you, but I just want to pick your brain because you, as the lone white man of the show, how does it make you feel when you hear all these conversations going around about racism and, the structures that we live in? Something that I've heard is that, what is it called, reverse racism, or that that perhaps sometimes a white person feels that they're also being discriminated in a way.
Sure, yeah. It's not easy, and yet I recognize, and this is through learning from my colleagues of color, that like my unease about it is like so minimal compared to so many other folks that I work with that live this day in and day out. I got kind of two answers to the question, and one is about resilience and one is about white fragility. And that's what I term it, and a lot of people term it. It is this like immediate, oh no, but not me. But I got Black friends, so I'm not racist. Oh no, but I do this, but I do this. And it's back to that idea of the pause kind of. It's the second I feel uncomfortable, I got to fill the space with my words. And I know in this country, being a white male, people listen to me differently. Being a male nurse even, I was listened to differently when I was practicing clinically at the bedside. Even though I was surrounded by doctors, if they were female, I had to keep saying, these are your physicians. These are the people that know what's up. I'm your nurse. So part of my practice is trying to really pause, but I feel that frequently. Oh, I need to make up for it. I need to cover this. And also working with my white colleagues to point that out to them and say, hey, here's this book, here's this reading, here's this, let's talk about this. Let's do our own work in our own space so that we can look at things differently and listen differently. I started working on this when I became a nurse in some ways, and then also after August 11th and 12th, I was living and working in Charlottesville, Virginia. And if you all remember, there was a massive gathering of white supremacists, profound violence. And one thing, living in Charlottesville, growing up in Virginia, all of us white people said, this is not us. These are people that came from far away. This is not us. We're so upset and embarrassed. And we were called out over and over again by our friends and our colleagues of color, said, no, this is you. This is your history. This is a city that was built by a slave owner, celebrated as a founding father of the country, and not looking at that. So it's pausing, it's stepping back, it's looking and talking about resilience. I teach resilience, I study resilience, and I need to recognize that there are some folks like me who have not had to practice resilience the same way that the majority of people in this country have had to practice resilience. So for me to say, hey, COVID's hard, hey, there's this violence going on, just bounce back. Like it's not the right thing to say. And so working with that definition and I f up a lot on it. Oh, I said I f up a lot. And we have to, I have a lot of work to do.
Well, Roxana, I was listening to someone this past week talking about, and Tim was addressing the question, which was about individual racism or individual bias. And that has its dangers. I actually wonder if the bigger danger is systemic racism and systemic bias, because if we correct that piece, you may always have individuals who maybe start out with that racist belief or position or bias, but our systems just reinforce it. So if those systems don't continue to reinforce the individual perspective, we would see massive differences, I think, in our health outcomes, if we want a healthcare context, but in so many other ways in which people's lives are affected every day by this.
Yeah, I think that as a clinical instructor, one of the things that I find that's difficult for sometimes students or, people I interact with is understanding what is, racism. But, I've never seen, I don't see people being overtly racist. So what is structural racism? What is an example of structural racism? It's really hard concept to kind of see the big picture. But one of the kind of examples that I think about that's going on right now. So I'm an immigrant. I'm from El Salvador. I lived in the United States for 16 years as undocumented. And then I had temporary protected status, and now I have a green card. But right now, I'm doing research with agricultural workers, and many of them are undocumented. And I think that structural racism is happening before my eyes because many of these essential workers are being left out of the CARES Act policies that could really help them. And so the Farm Workers Association of Florida is trying to fill that gap by providing food on a weekly basis to 300 families. Essential workers who are providing food for us are having to get food donated to them. I think that's somewhat of a clear example of structural racism that goes on, where the people at the table who are making all these policy decisions, there aren't people like us who are there to say, but you're forgetting this very important group of people. So do y'all find that to be difficult to try to explain to your peers, to your students on what is structural racism and make it clear for them?
I do think that that is a challenge. And Carolyn, I like how you kind of broke down the difference in the kind of the individual versus the systemic. And I think that the first civil rights movement was a lot about individual kind of fair treatment, right? We deserve to be able to eat at the same counter. We deserve to be able to go in the same bathrooms. We deserve the same educational opportunity. And so I think behind that civil rights movement, everybody felt like there was a win, right? We won. But then there was this slow shift to realizing, well, yeah, you can come in, but you're still not welcome here. And so now you have the new movement, which is very much focused on the systemic. Don't invite me to the table and then not want to hear my voice. And so when I think about systemic racism, it is the perpetuation and the continued development of structures that disproportionately affect certain groups and advantage other groups. So if you develop a system that certain people are able to be more successful, have more access to finances, have better access to, be able to buy a home or whatever, and other groups cannot, and there's when you look statistically at the numbers, there's a huge gap in it, that is called a disparity. And that disparity, those numbers suggest that there is systemic racism and bias. And people don't like to be called racist. So, institutions especially don't like to be called racist because they think that means unkind. But racism you can be kind and unfair. So we need to stop mixing up and getting the emotions into it. It's fact. If you are advantaged more than someone else, and they're telling you that, hey, I'm disadvantaged, I'm disadvantaged, I'm disadvantaged, and you don't change anything, you're a racist organization. Whether you want to accept it or not, that's your problem. So when I talk to students, I tell them, because I've heard some white students say, I only lived in white towns with white people. There were not really any Black people around. I had no context of even being around other groups of people, so I don't even know. And so some of it is helping people to understand, because I think some people really don't understand what racism is. They haven't felt it or seen it. But I always, and I think I said this on another episode, when you're entering the healthcare system, it's critical that you understand those differences, because you cannot care for populations of people and not understand their social environment from which they come. Their environment that they're born and raised and live and grow, their social determinants are what makes them them. And then they come into a healthcare system. So if you lack the ability to know that, or at least be able to connect with them enough to get it, then you can't change health outcomes. So I always talk to the students about, these are larger societal issues, not just you hating someone because of their skin. That's step one. My skin is, I have a sweatshirt, I should have put it on today. It says, my skin is not a weapon. You got to get past that feeling of looking at me and seeing brown, or, hearing an immigrant accent and thinking less than. You have to break that down first, but then you have to teach people, okay, so how do I take it to the next step and change the structure?
Yeah.
There's this great document, maybe you'll have seen it. It's called The Characteristics of White Supremacy Culture. It's by Kenneth Jones and Tima Okun, and it bullets out different aspects of systemic racism in leadership cultures. And I think one really interesting point is when there are decision-making structures that are created in a way that no one actually knows how to get a decision made. That we don't know. We know these people at this level at the top have to make the decision, but we don't actually understand in the structure how to get that voice there to make that decision. And it's intentionally created, which is a lot of large organizations and businesses in this country. Like, that is one of the many aspects of white supremacy culture. And I think this document it's helpful to look at things with the frame perfectionism as well. The need to be perfect, the need to stick to an agenda, which doesn't allow voices at the table. How do you parse that apart,
Yeah. So we actually have a great interview with Dante Flanagan. Now, he is a African-American man in nursing, and he has risen all the way to the top to nurse anesthetist. Did I say that right?
It's always a tough one. Anesthetist.
Anesthetist.
So he's a CRNA, is that?
Certified Registered Nurse Anesthetist.
Certified Nurse Anesthetist.
Yes.
That's hard.
Exactly.
I think Lexi just covered you, by the way, Tim, on that CRNA comment.
Oh, I did. See, I got you, Tim.
All right. I'll take an extra point of yours.
So I think our wonderful Director of Communications, J. Michael Moore, interviewed him. And so we have a clip for all of us to watch, one of our very own from Emory University School of Nursing.
Dante, thanks so much for being with us and talk about the many, many topics that you are qualified to talk about as a CRNA and also an alumnus of the Nell, Hodgson, Woodruff School of Nursing. I want to start out by just asking you, how has your job been? New Orleans, where you were based, was a hot zone for COVID-19, and for someone who does intubations and all of that medical work, it had to be very tough on you.
Yeah, definitely. Jim, thank you for having me first and foremost, but also, things are calming down now. This is going into our fifth month of the pandemic. The first couple of months were very exhausting and draining, and just put you into a different state of mind as far as becoming desensitized to what was going on. It really felt like a war zone for a solid 6-7 weeks, where you were coming in and just trying to, do what you could for the wounded and the hurt. And I definitely saw more death than I'm used to seeing, accustomed to seeing on a regular basis. And now that's not the norm right now. And I'm hoping that it continues and we can continue flattening the curve. But it's definitely been a long 2020 for this country and for this world. So, yeah.
Absolutely. Well, I think I speak for everyone to say thank you for your hard work and, um, in many cases, putting your own personal needs aside and fighting for this cause. What we wanted to talk to you about today, however, was more in line with what you do as a speaker and as a
Mhm.
preceptor and the things that you do to advance the practice of nursing,
Mhm.
particularly as CRNA. And also to get some of your thoughts on the state of the world socially.
Mhm.
There's always been instances of racism and concerning things involving race and diversity in healthcare, both patient side and also on the doctor and nurse
Mhm.
side and working in that environment. But let's just start out a little bit and just let me know what your experiences are and what have you noticed that has been perhaps improving or perhaps
Mhm.
still a problem that we need to work to address.
Yeah, I think the reality is that biases are definitely a part of the profession and in healthcare in our lives, and I think um, this is definitely the moment for us to lean into that and not to look at it as a negative, but to embrace it as an opportunity for learning and for growing. I think a lot of times what I've seen is in our culture right now, in the climate that we're in, is that when we speak of biases, that um, certain people, individuals, feel victimized or attacked. And I think it's important for us to acknowledge that we all have biases. And one of the biggest things that I've seen that has helped with that is one, taking like the Harvard implicit bias testing, and just so you can see where your biases stand and lie. And it doesn't have to come with an issue of racism, so to speak, because you can have biases against your own race and people that look just like you and your own culture. Um, and I've seen that it feels like the climate has gotten a lot more sensitive to um, hearing those words and understanding that we have more to learn and more to gain and more places to grow as far as it comes to acknowledging different cultures and respecting other people's wishes and how their lifestyles. Um, yeah.
2020, I think everyone certainly feels the pressure and
Hmm.
the tragedy that's taken place in this year. But for me, looking on it and my thoughts is that hopefully all of this brings us forward and this takes us
Right.
to a better place.
Hmm.
Um, how has it been in your eyes, just all of these or this
Hmm.
intersection of all of these different roads, hitting? We have COVID-19. We also have, what has happened in police with black men of
Hmm.
late, and all of that becoming very much in the national conversation. Is that something that is felt in your role and something that you feel is helpful or detrimental?
Yeah, it's definitely felt. There is a definitely a cloud of tension throughout healthcare and throughout our lives that I think we have to just face head on. And the pandemic and the internet and just access to media and people being out of work, unemployment, sitting in front of the phone, sitting in front of the computer, um, has brought a lot of things to light that have been happening for centuries. And I think that it's like this microcosm of things have come together. It's like right now is a time where we get to see it, where we have a captive audience and people. It's much harder to look away and say these things don't exist when you're seeing it in front of your face. And so sometimes that allows for open conversation, but sometimes we're still having the victimization and feeling, I think, being like people feel like they're being called a racist or not. That tension is still there because internally most of us feel like we're good people, and we may not intentionally have these ideas of negativity towards certain people. We may think that no, people are generally good, but there's a subset of people inside of our country that are suffering greatly, and we're seeing it. We've seen it play out in the treatment from the police department. We've seen it play out and the pandemic. And we've seen just lack of resources throughout the country when in New Orleans, for instance, we have a city that's 60% African American, yet 80-90% of the wealth is in the white community, and thus the resources go there. And so the education system suffers, our healthcare in the city suffers from that on a percentage basis, because most of the population here is in poverty, and has a lack of access to resources. And it's not just New Orleans. I think we're seeing the results of it across the country, where you see these communities that are have gone out of business. 40% of Black businesses have gone under, despite the PPP loans. You've seen the majority of people who have died from COVID were in the Black community. And that dives deeper into the deeper issues of race throughout the city that we can't ignore, or if we do, we're choosing willful ignorance because it's right in front of you. I think right now I saw some stats that COVID-19 is the third leading cause of death for African Americans this year, higher than heart attacks and cancer. Something that's absurd. But this is the reality, and I think it highlights the other issues that have been plaguing our community for centuries.
Right. And there's certainly the questions about access to care,
Mm-hmm.
and also just in the healthcare system itself. Do you
Mm-hmm.
have any experiences that you could share in a general sense of
Mm-hmm.
things that you have faced as being a practitioner, and in terms of, you being a male in
Mm-hmm.
the field, and also an African American male?
Mm-hmm. Yeah, one of the starting at the beginning from when I chose to go into anesthesia, it was an opportunistic situation that presented itself while I was in nursing school, and I had a wonderful preceptor or kind of a CRNA who kind of took me under her wings while I was in labor and delivery unit at Emory Midtown, where I wasn't doing much as a student, but she took me under and said, "Hey, come shadow me, come hang out with me." And one of the things that she told me was that, it's a great opportunity for me to reach into anesthesia because me being a Black male in nursing, we are so underrepresented when it comes to nursing, but even more so in the field of anesthesia. And I think that speaks to the lack of reach out from the profession, but also there's a piece of that comes with the different various barriers that line itself up along the way. The idea that I didn't get introduced to the profession until I was a nursing student on clinicals. So that means that I've gone 20 years not hearing about the profession, not seeing anyone that looked like me in the profession to embrace me and welcome me into it and guide me through the steps. I've tried my best. One of my biggest initiatives and goals is to fix that, and it's to be a prominent face, and a face out in front that says, "Hey, we are here, we exist," and it's a field where you can change lives and touch lives every day. But I've also seen where I remember in New York, which something that really opened my eyes was I had a patient who was maybe in her 70s or 80s, and she was on her 18th to 20th procedure. And she said that I was the first Black person who's ever put her to sleep. And that blew my mind in a city like New York, in a space where someone's had multiple interactions with the anesthesia department, and to know that I was still the first person that she's had provide that kind of care for was just mind blowing to me. And I've seen other things from patients that their reaction is different. It's interesting sometimes how sometimes people's feelings change. Like you may not outwardly want a Black person or nurse taking care of you until your life is on the line, and then you realize how little that matters, how little skin color matters. And I've had those interactions where I know that outside of me saving your life, we would never be caught speaking to each other. You would never embrace me in a kind manner. And medicine has a funny way of kind of breaking down those barriers when it's life or death on the line. But that just also speaks to the idea that we need to start crossing over and understanding our cultures more and more. Understanding that my skin color doesn't make my heart any different towards you, but it can change how you react to me because it is the first thing that you see. And the only way to fix that is to start opening our eyes and opening our ears and our hearts to the experiences that other cultures and the Black culture and other minorities are having, and understanding that their experience is much different than what the majority of the people in the country experience on a day-to-day basis. And it's a real experience.
Wow. Thanks so much for sharing that and being candid. One last quick question before we go, and it comes from your comments about how you pursued this as a practice. It sounds like you had somebody that was on your side, a nurse that wanted to help you advance your career and become a CRNA. And what is the importance of allies in this cause, and those that speak out that aren't a person of color, that will really help move things forward?
I think that, allies are huge. And I think that allies have to understand that, though, as a Black person in America, I have to understand that I did not help write this system or the laws that I'm forced to be governed by. Therefore, my input wasn't taken. And a lot of the people in power are the white people who can be our allies to help change that. But it takes them acknowledging that we have been forced into a system that we didn't build or we didn't write the code for. And I've had allies that had to step up and speak on my behalf. Namely, one wonderful and everyone that a lot of people in Emory know, Barbara Reed. She's done so much for me that people know and don't know, but a lot of that was seeing me for who I was and knowing that I had something special to offer. But she also understood that her position offered her a place that I was not welcome to just out front. And she has always used her platform for a positive for me, and being an ally for anything that I was going through or dealing with, and understanding that my experience was different than the general public and the general student at Emory. I've had other people along my career that have done the same thing, that have been willing to step in on my behalf and speak to my character, and offer up understanding of more of the culture and my background than just what meets the surface. And that, I think that is super important, given that allies have the power to fix things. We are living retroactively as a result of these issues and these laws, and it's going to be up to the allies to step up and speak out on our behalf to make these changes. Black America has been saying the same thing for decades, and so for us, the way that we live and experiences that we have aren't new. We've learned how to cope with them, but as you see, they continue to happen. And until more people speak out, understanding where we come from and on our behalf, nothing's going to happen. Nothing's going to change.
Absolutely. Thanks so much, Dante, for taking some time. Before we go, is there anything that you're working on or something that you'd like to share with our viewers and listeners about what you're doing with your career?
Yeah, definitely. This actually, as most recently, I've put out my book, my memoir in June, called Dream Big. And on top of that, you could visit my website at www.drdanteflanagan.com, and where I run a nonprofit organization that mentors to prospective nurse anesthesia students, specifically of color and underrepresented populations. And I have a 3-tier system now that includes GRE awards, scholarships, financial literacy, and a mental health component where we have monthly sessions with a licensed therapist from Oakland, just to help the students cope with the experiences they're having in anesthesia school and clinicals and didactics, where they may be the only student in their program. It may have been that way for a couple of years, and their experiences are different, and understanding how to empower them to go forward and move forward and to be successful in their experience. So yeah, the mentor program and the book are my big things right now, keeping me busy.
Sounds great. And I'm sure people will love to go check that out. And we really enjoyed getting your thoughts on this. Thanks again. And we hope to talk to you again soon.
Okay. Thank you.
Wow, what a powerful interview and heartwarming to see, to learn about his journey. That was amazing. I think that sometimes when we talk about race and racism, we have a feeling of despondence, like there's so much to do and it's just tiring. But, hearing from Dante and his journey and how allies have really kind of helped shape him in his career journey, I think is amazing. And it resonates with me because I think that allies are very powerful. And, it's not just about recognizing your privilege. We like that you recognize that you have privileges, white America, but it would be better. It's better that you use your platform, your power, your position to tap people, to guide them through their careers. I think that's how we make some change. These personal connections really kind of can start changing the fabric of America and making us, be the true Americans that we are. We're inclusive, a melting pot, and there's enough for everyone.
Roxana, if I could say just a thing about Barbara Reed. I was at Emory as the younger instructor then when Dante was there, and I remember seeing the two of them and understanding that she was an ally, a sponsor, meaning she was coaching him, mentoring him. And I think that's very important to consider who you're mentoring, who you're tapping. But for her, it wasn't just that she was individually sponsoring or mentoring a student who, and I don't know how their attributes may align, but from the outside, just visibly look different in age and race. But for her to do that was representative for younger professionals like me who that planted a seed. Right. So she role modeled something for me as a professional who's more established in her career. I may have seen myself long range as doing something like sponsoring someone who was more like me, based in my experience. And to see her do that really disrupted a thought that I had fixed already about a different way, a different path, a different way to use my influence when I had it. It was really a powerful thing that she did. And I was so glad that he mentioned her. It appeared from the outside that they had a very special relationship. And I'm so glad that it was helpful for him.
Yeah, I agree. I think allyship is very important. I've had some wonderful mentors. I wouldn't be where I am without mentors, and they've been from all different race, just, different backgrounds. And it has really helped me to see the world in the different colors and dimensions. I can really appreciate that. And I too have taken on students from a variety of different backgrounds, because I think it's important to also do it in the opposite direction to help build up a new workforce of nurses that have a different way of looking at the world. So I agree with you 100%, Roxana. I think that was a very powerful thing that he shared.
A couple words that really resonated with me from Dante's interview were willful ignorance.
That was on my list, Tim. I'm glad you brought it up because I got some stuff to say about it.
Let's dig into that. Yeah.
Let's dig in.
In my own experience in hearing that, what I heard was my ability as a white male to not even have to pay attention, to not even have to ask challenging questions, to move on to the next thing, to not even make an excuse to move on to the next thing and shut down the conversation right then and there because I can. And that is a willful, I'm being willfully ignorant by doing that. Or making excuses around it. We got to get on to this thing. We have to do this next thing. We don't have time for this. And it makes me also think about how many nursing students have we lost in nursing programs across this country because of willful ignorance, when they don't have the mentors to support them and they feel completely out of place in their programs. And so they make a choice and they move elsewhere. Thank God for Dante. Thank God for all the mentors out there that are pushing against that and build that. And how do I recognize my willful ignorance? And this is new to me.
Yeah, the willful ignorance thing, I almost don't even want to call it ignorance, because you're doing it. And there's a professor at Emory, Dr. Carol Henderson. She's a professor in the Candler School of Theology, professor of African American Studies, and she has a book called White Rage. Ultimately, it is the intentional, purposeful efforts by white America to dismantle and dislodge and just make sure that certain groups never can get into a position of power. And this is where you see a lot of the Tulsa, Oklahoma, a lot of the historical things, Black Wall Street. There is an ignorance for some, but then there's also this rage, this anger at how dare you try to disrupt the system that's in place. You know, so some of it's ignorance, Tim, but some of it is like purposeful and intentional. So when we think about our healthcare system, you know, all of it's not passive. The things that are happening in the schools of nursing and in the hospitals, all of it's not just passive because we have this history. No, some of it's intentionally designed to keep the status quo. And when you try to come in and disrupt the status quo, you are eliminated. This is why when we decided to do this conversation, I was like, how honest can I actually be? Because you have to be careful when you're trying to disrupt status quo. It is never received well. It is always looked at as you are trying to, we have this, it's already set in place.
Troublemaker.
Good trouble. Good trouble, right?
Yes.
But anyway, so that ignorance thing, I'm like, some of it's ignorant, some of it's intentional.
You know, as a Hispanic woman immigrant, it is hard to kind of navigate those. It is hard to navigate those structures, but it's wonderful when someone sponsors you. You have a mentor. Like for me, Dean Linda McCauley has really helped me throughout my journey. She has been a wonderful ally, and not just her, but Emory as a whole, I think, has been really good about supporting me, and I think is trying to step up and supporting many other minority students in the school.
Definitely. I love our school. It has been, Emory has, you know, back when I was a little kid, my dad told me this. I didn't grow up with my dad in my life, but we used to write letters. And he said when I was about 16, I put in a letter that I wanted to be at Emory. How I knew about Emory as a 16-year-old, I have no idea. But there was something about Emory that at some point I learned about. And I think Dante hit on this, the importance of exposing people early. There's something about Emory that spoke to my heart back then and even now. And I just wouldn't be the person I am. And I do think that Emory is a leader and is taking the charge in this area. We are, you know, we do have a ways to go, but I do think that people's hearts are in the right place and people are willing and ready. So I don't want to, you know, come off as negative when I talk about some of these things. It's just that it's a lived experience. It is very hard to come from it's almost like coming from a background of trauma. And when you ask certain questions, Roxana, it pulls off stuff and it's painful in there. But when I think about Emory, it has been such a bright light in my life and a platform by which I think we can change the world and we can make a difference in our profession. So I'm very grateful to the mentors and the leadership, especially at our school.
Yeah, the culture is so interesting. So we have these values about being excellent, being innovators, focus on social responsibility. And the culture, we actually had some outside parties looking at some of our materials and kind of getting to know us a little bit as an organization. And they use the word rebellious. We're a bit rebellious, but you know what? You need to be, right? So if we're going to disrupt these historically baked in approaches to our space, which is around nursing education and research and practice, we have to be a little bit rebellious to make that good trouble. So I'm with you. I think it's a wonderful place to be.
And isn't that why we signed up to be nurses, to deal with disruption? I mean, the illness, right, is a disruption in your system that makes you sick. And so we train as healthcare professionals to address the disruption, to realign it, so that you can go home and be with your family and be the amazing human being that you are. And yet at the same time, I think when disruptions come up that make us particularly uncomfortable about race and social injustice, we forget that we signed up to roll with disruption and be a part of disruption. It's almost like maybe that's part of the willful ignorance. We choose the disruption we want to tune to, but if we're going to be nurses and if we're caring for the whole body, which is the whole human race, we need to be open to that disruption and innovate with it and listen.
Yeah. I think my two favorite values at the School of Nursing are excellence and social responsibility. You can be excellent and still uphold social responsibility. I think that it's not one or the other. Both can be done. And I think Emory University and the School of Nursing does that.
Yeah, for sure.
Couldn't agree more.
So, but this was a fun, interesting, and enlightening episode. So with that, I want to invite you all to please follow us on social media. We have the Nurses Station on Twitter and the LinkedIn Nurses Station as well, where you can join discussions. And please send us your comments. Let us know what your thoughts are, what episodes you'd like to see, what discussions you would like to, hear about. And also log on to nursing.emory.edu, the Nurses Station, to get more information about all of us.
Oh,
Hey, Roxana.
Instagram too.
Instagram, yes.
Instagram.
Do we have it? Do we have a TikTok?
No, well, we can
I
do
hope
one.
so.
Oh,
Tim can't do a
Yeah, yes.
TikTok. Tim clearly has no
Do I look
rhythm, but
TikTok? I'm trying. I'm
Sorry, hon.
practicing. Hey, Roxana, quick question.
Yeah.
If we cover a topic that the audience, it really resonates with the audience, and they feel like we're just scratching the surface, can we circle back around and do more episodes on that topic? I think there's a lot that has come up in here that merits a lot more attention. Is that possible?
Absolutely. Absolutely. I think that this is an ongoing topic that we need to continue discussing, and perhaps in public forums is good because we have a bigger reach. Yes, I think we're all down for that, right?
yeah.
Let us know, guys.
Yeah, let us know what your thoughts are, what you'd like to hear us talk about. Maybe we can do a part 2 to this. I have much more to say, but I would love to hear from the people listening and kind of dive into some of those topics also.
Yeah.
We look forward to that.
All right. Bye, everyone.
Bye.
Bye.